Hello, everyone. My name is Dr. Michael Wald, and welcome for this conversation entitled Dementia on the Rise, and Here is Why. So what we'll do over the next 10 or 12 minutes or so is I'll discuss the various causes of dementia and why we know it's on the rise. We'll discuss some preventative measures along with causes, nutritional influences, and I'll even provide you with what I call my blood detective laboratory tests. Many of these tests your doctors won't know about, but they are helpful in determining causes, monitoring dementia, and examining the nutritional aspects of dementia. So the information that I'll be describing to you right now is meant for your educational purposes. It's not meant as a substitute for sound medical or health advice. So let's begin with talking about the contributing factors to dementia and why we know it's on the rise. Well, number one, we have an aging population, and increased life expectancy leads to higher numbers of older individuals and therefore elevated dementia prevalence. But besides that, we know it's on the rise not just because of more diagnosis, but because of the incidence of chronic disease that we know have a direct correlation with dementia, or an indirect one. For example, cardiovascular risk factors. So conditions like high blood pressure or hypertension, diabetes certainly, obesity, all are related to higher dementia risks. And I just want to remind you that it's always better to prevent this condition than to treat it, because the medical treatments for it are a miserable failure, unfortunately. I wish it was different, but it's not. And then other lifestyle factors such as physical inactivity, poor diet, and smoking all contribute to cognitive decline. And also there's a relationship between educational and socioeconomic disparities. For example, those that have limited access to education and healthcare resources generally have an increased risk of dementia, not to mention other diseases and health problems. So let's talk about some of the emerging insights and preventative measures, and that means knowing what some of the triggers or causes of dementia might be. So one is infectious agents like sexually transmitted diseases. Herpes, syphilis, for example, may elevate dementia risk. Rising sexually transmitted disease rates among older individuals are very concerning, and we know have an adverse effect on the nervous system, which is the place where dementia sort of happens. So these conditions, through a variety of mechanisms, including causing excessive inflammation in the brain, will lead to dementia. And vaccinations. So shingles vaccinations, interestingly enough, have been associated with a 20% reduction in dementia risk, highlighting the role of viral infections like shingles in cognitive decline. And then in terms of other preventative strategies, which are those things that you can modify, what are called modifiable risk factors, like managing blood pressure, lowering of cholesterol, managing your weight, engaging in regular physical activity, all can help prevent dementia, reducing risks by up to 45% in men and women on average. Additional lifestyle strategies to prevent dementia include regular physical activity. Regular physical activity will enhance blood flow to the brain, and that's going to promote a process known as neuroplasticity. And that's just a fancy term for the ability of the brain and nervous system to make self-corrections, and exercise increases that ability. So you want to aim for about 150 minutes per week of moderate aerobic exercise. And what about the Mediterranean diet? That always comes up when there's a conversation about dementia or heart disease, obviously. But we know that diets that are rich in leafy greens, berries, olive oil, fish, raw nuts, reduce inflammation in the body and favorably affect other aspects of our chemistry that might lead to an increased risk of dementia. But overall, these healthy diets reduce oxidative stress and support vascular health or blood supply to the brain. So I like to do what I call a blood detective diet, where I do a consultation with a person. We look at the responses to a whole bunch of questions. Then we draw specific laboratory tests. And then based on those laboratory tests, and a lot of them are nutritional, I might say to a person, yes, I believe that you should be on a plant-based diet, but we need you to have a diet that's high in ketones. And a plant-based diet is really not. I mean, you can have berries, and berries do increase ketone levels somewhat, but not so much. But we would add medium-chain triglycerides as a supplement, by the way, and that will cause effective levels levels of ketones to increase in the body. Ketones are a necessary fuel for the repair and neuroplasticity of the brain. But if a patient also has diabetes and hypertension and a gluten intolerance, for example, you can imagine how the dietary plan and supplement plan would change specifically for each individual person. Everyone I see has some differences in the recommendations that I give them, even if they all have the same diagnosis of dementia. Because remember, dementia is just one of the health problems. There's usually a multitude of other comorbid conditions, and they need to be paid attention to nutritionally as well. And then sleep quality. Poor sleep is linked to amyloid plaque buildup. And amyloid is this abnormal protein that is associated with some forms of dementia. We want to target between 7 to 9 hours per night of sleep, and we want to address any sleep disorders, snoring, or sleep apnea that may be there. Without sleep, we don't heal. And what's also important, besides getting the 7 to 9 hours of sleep, is having a regular sleep and wake lifestyle so that you go to bed and you wake up at roughly the same time. That might actually be more important than the number of hours of sleep you get per night. But we want both. We want the 7 to 9 hours, and we want a regular sleep schedule in terms of the time you wake up and the time you go to sleep. So let's talk about some other lifestyle strategies that you should be mindful of in terms of prevention of dementia. And the first column here is the mental and social engagement. This is very, very important. Lifelong learning and social interaction build cognitive reserves. Engaging in puzzles, music, language learning, or group activities seems to stave off dementia. Now, there are some studies that say that none of this works, but common sense would tell you if you don't use it, you'll probably lose it, so it can't hurt. And then there's stress reduction. Chronic stress, that's stress that lasts too long, that's usually characterized by high levels of a stress hormone called cortisol, can accelerate brain aging. So we want to practice mindfulness management, such as the introduction of regular yoga practices or meditation practices, nature walks, for example, and they need to be regular. Now, also with chronic stress, I mentioned the high cortisol levels. That usually goes along with low levels of testosterone in both men and women, low levels of estrogen in both men and women, but especially women, and also low levels of the adrenal hormone, which is needed for repair, called DHEA. So any thorough workup on dementia, whether it's prevention or treatment, should look at the total hormonal milieu of the individual. And then we want to avoid various neurotoxins. We want to limit alcohol, which is certainly a neurotoxin, as is tobacco, and also plastics. There are many of them. And I have other podcasts which talk about neurotoxins, which you can find on my website at drmichaelwald.com, or you can search any podcast platform. Just search for Ask the Blood Detective. If you can't find something, go to my website, click the contact button, and let me know, and I will make sure to get it to you. And then you can have all this information and you can go to your doctor, but if your doctor is not open to doing the correct tests, and if they're not aware of all these different things, then you're really pretty much on your own. But the reason I did this dementia talk again, and I'll do other ones, is because the medical management of dementia, along with other chronic diseases, as far as I'm concerned, is completely inadequate. So by improving your education, you could ask for specific things from your doctor. And then the chances of your doctor doing these things, once he or she sees that you are a well-informed consumer, are much, much better. And that helps you stay healthy and keep your identification of who you are. So in terms of laboratory tests and dementia risks, if you have, for example, low levels of B12, and you do not, and your body does not do this process, this healing process of methylation, you are at absolutely increased risk of dementia and also many other diseases. Low vitamin B12 impairs cognition and myelin function. Myelin is a protective coat around the central nervous system. And methylation, as I mentioned, is a process where the body heals. So the B12 that you want to consume, along with the folic acid, should be methylated forms to promote methylation. And that's emphasized in the next set of testing here, homocysteine and MTHFR genotyping. So homocysteine is a toxic amino acid, and it circulates in the body. And if you're genetically predisposed or environmentally predisposed or a combination of both to dementia or anything else, homocysteine will damage those tissues. So it will circulate in the brain and cause disruption of circulation, which will kill brain cells, kill the neurons, and forward dementia and other health problems. So you want to keep your homocysteine levels low. We know that elevated homocysteine increases vascular dementia risk. You would think that every neurologist would be measuring B12 and homocysteine, but they are not. And the same thing with APOE genotyping. Identifying genetic risks for Alzheimer's is related to this particular gene. So if you're a carrier of the APOE gene, you certainly are genetically predisposed, but that doesn't mean that there are not things that you can do to mitigate your risk, and that's what we're talking about here. And then there's high sensitivity C-reactive protein. So there's high sensitivity CRP, C-reactive protein, or there's just CRP. You want the high specificity one. Why? Because it picks up low-grade chronic inflammation, which is associated with dementia and other diseases, much earlier than the regular CRP. So when you go to your doctor and you say, I want a cardio CRP, they will say, well, I just do the CRP. Or you have to tell them, I want the cardio, and they might still do the regular CRP, so you have to make it very clear. When you say cardio CRP, they're not just listening to their default test, which is C-reactive protein. The higher the C-reactive protein, the more inflammation there is, and the greater the risk for dementia and brain and neuronal decay. So you need to know that CRP is a marker of inflammation and also infection, by the way. And then there's thyroid function tests, TSH, thyroid stimulating hormone, that's actually an anterior pituitary hormone, and then free T3 and total T4 are the thyroid hormones. Hypothyroidism or low thyroid function can mimic or exacerbate cognitive decline. I have had patients that have been diagnosed with dementia and all they had was low B12 levels. In other cases, all they had was hypothyroidism. And once you corrected that, guess what? Their brains did much better. With other people, if they just ate a high protein breakfast and ate regularly throughout the day, they were also thinking a lot better. Yet others, exercise, that did it. Sometimes people need a combination. And how much of each of those things is what individual assessments figure out. That's what the whole blood detective approach is. Individual examination of a person, comparing themselves to themselves over time to make sure that the things you're doing work. And then there's fasting glucose, and then a test that measures several weeks average of your blood sugar, known as hemoglobin A1C. And then there's insulin. Glycemic dysfunction, which is blood sugar imbalances, contribute to what's known as type 3 diabetes, which basically is insulin resistance and chronic inflammation in the brain. And then possibly measuring omega-3 nutritional compounds. So we know that fish oil is EPA and DHA. EPA is the type of fatty acid that does have some brain benefits, but that's mostly for cardiovascular health. It's the DHA portion of the fish oil. When you purchase a fish oil supplement, you want to get one that's higher in that's higher in DHA and lower in EPA. I'll say that again. The fish oil supplement should be higher in DHA and lower in EPA, not the reverse. And then finally, last but not least, is the role of heavy metals such as lead, mercury, and the toxin arsenic. There's also cadmium. So toxic burden is known to contribute to neurodegeneration. Now, these tests are not all that there are, and I don't necessarily do all of these tests on every person, but I commonly might. I will do tests that are appropriate for the total health picture of that individual. And then once we do the laboratory test, then I figure out a food plan for a person that must be doable and not neurotic. If I recommend food suggestions that are perfectly tuned to a person's biochemistry who wants to prevent or treat dementia and they can't do it, it's of no use. So I'm very much into practical suggestions, but are as concise and accurate biochemically and nutritionally as possible for that individual. And then there's always the use of nutritional supplements. Yes, I believe they are important. No, food does not reduce the need for nutritional supplements. There's lots of reasons why we want to use nutritional supplements, and I've done several different podcasts on that you can check out on nutritional supplements. And then the levels of these vitamins and minerals and phytonutrients are going to be much higher than the recommended daily allowances. Those RDAs, the recommended daily allowances, as many of you now know from listening to so many of my podcasts, are representative of only the minimal amount of a nutrient to prevent a deficiency disease. That's what the RDA is. It's not an optimal amount to promote wellness or to help beat dementia. So that's why the nutrient levels are higher. So when your doctor looks at the supplements that I recommend to you and says, these are so high, they're so much higher than the recommended daily allowances, they have forgotten what the recommended daily allowances are. And another tip, when I look at the blood work of someone with dementia or any other problem, I'm comparing them to two ranges. One is what every doctor uses, the clinical ranges of cholesterol and magnesium and B12 and whatever the tests are, there are clinical ranges. Those are based upon average men or women your age that are seemingly well, that donated blood. They don't represent super healthy people, but studies have been done and there are ranges that are differently placed that you find in much healthier people. I call them functional or healthy ranges. And if you listen to one of my podcasts, which is on longevity, of a few of them, I talk about these ranges more. When I use the tighter, healthier ranges, I can pick up a lot of hidden information because I have had one too many patients say to me, Dr. Wald, my doctor did these blood tests. He said they were all normal. And then when I compare them to healthy people, they're not normal. And those abnormalities seem to correlate with the person's issues. So I hope this information was useful for you. This is a topic that you will hear plenty more of from me. Please let me know your thoughts about it and whatever topics you would like to hear besides these. And I'll see you at the next podcast. Thank you so much.